Welcome to Module 8, Integrated Bite Case Management. My name is Ryan Wallace, and I'm a veterinary epidemiologist with the U.S. Centers for Disease Control and Prevention, where I lead our implementation of rabies surveillance and prevention programs. Integrated Bite Case Management, often abbreviated as IBCM, is a method of passive disease surveillance in which animal bites are used as an alert or event to trigger a rabies case investigation. In most IBCM programs, implementation requires close coordination between the health clinics and veterinary professionals to ensure that bite events are reported quickly by health clinics and investigated thoroughly by a veterinary professional. And then the outcomes of these investigations are used to inform a bite victim's treatment plan or dog vaccination practices. IBCM may seem like a new concept, but in reality, many countries operate IBCM programs on a daily basis. But often these programs are termed animal control programs or rabies surveillance systems. For example, where I work in the United States, our IBCM program oversees the investigation of nearly 100,000 suspect rabbit animals every year. IBCM is the ideal method for rabies surveillance, and as you'll hear in this module, it is possible to implement these programs in nearly any setting. In this module, you will learn what integrated bite case management is, why IBCM is useful, and what IBCM in action looks like. Rabies prevention can be achieved through two primary vaccination methods, although a combination of these two approaches is almost always recommended. The first preventive system that is typically implemented in a rabies control program is the provision of human rabies vaccines. We refer to this as the reactionary vaccination system because the vaccine is provided in reaction to the victim experiencing a rabies exposure. Reactionary rabies vaccination is highly effective at preventing human rabies deaths, so long as bite victims seek medical care and PEP is available in the clinic. Yet, despite human vaccines having been available for over 100 years, still 59,000 people die from rabies each year. Why is this? Well, one reason is the cost of vaccines. Depending on the vaccination protocol used, the post-exposure vaccination series can cost a bite victim over $100 US. In many rabies endemic countries, this cost is equivalent to an annual school fee or a monthly salary. Clearly, costs are a large barrier, especially for low-income families. Other limitations of relying upon reactionary vaccination include frequent vaccine stockouts, long travel times for people to get to clinics with vaccines, and just a general lack of community awareness about the need for post-exposure vaccination. But we must always remember that rabies is not maintained in humans. We are the unfortunate spillover hosts of this virus. Most often, the virus is maintained in the free-roaming dog population. Any permanent solution to preventing human rabies deaths must address the disease in dogs. Thankfully, rabies vaccines for dogs have also been available for many decades, and these vaccines are not only widely available, but they are also very inexpensive. Considering all costs to vaccinate a dog, such as the vaccine, shipping, the vaccinator, and community awareness, we should be able to vaccinate a dog for around only $2. Which is 20 times lower than the cost to conduct reactive vaccination in people. While reactive vaccination must be implemented early in a rabies program to reduce human deaths, the long-term strategy should be to reach vaccine herd immunity in the free-roaming dog population. It is often proposed in rabies programs to simply increase access to human rabies vaccines to eliminate dog-mediated human rabies deaths. While this may be theoretically feasible, the cost to implement such a program could become unimaginably high, and when considering the frequency of dog bites to humans, the cost effectiveness of such a proposal would be highly questionable. While rabies is almost always transmitted from a biting dog, not every dog that bites has rabies. Dogs have evolved to live with or near people, and as such, human-dog conflicts are inevitable. Whether it is a dog that is protecting its puppies, guarding a food source, or just playing a little too rough, Dog bites are an incredibly common occurrence in most communities. Many studies have shown that anywhere from 1 to 5% of community members are bitten by a dog every year. In a world with 7 billion people, this would be over 70 million dog bite events every year. With tens of millions of dog bite victims each year, why do we only see 59,000 deaths? Well, this is because most biting dogs do not have rabies. Recent studies in Haiti and the Philippines, which had veterinary professionals assessing biting dogs, found that the vast majority of these dogs were healthy. Now, this is not to imply that a dog bite should be trivialized or ignored. With just a simple risk assessment recommended by the World Health Organization, we can rather easily determine if PEP is indicated. We will cover that in a few slides. This brings up several critical issues to address when considering how to improve PEP accessibility, and one of the key benefits of a high-functioning IBCM program. First, there is not enough PEP in the world to treat every dog bite victim. Second, the cost to low-income patients can be detrimental, and the risk of rabies in a normal dog bite may not justify the expense of human rabies vaccines. And third, as we scale up human vaccine accessibility, we need to ensure that vaccines are available to persons with true exposures and not overused by people with no or low exposure risks. Implementation of a highly accurate IBCM program where the health assessment of the biting animal can be used to inform human treatment decisions can lead to drastic reductions in the unnecessary use of human rabies vaccines, and it can divert these vaccines to people who are more likely to have had a true rabies exposure. Currently, it is estimated that we spend far more money on reactionary vaccination measures as compared to primary dog vaccination programs. The result of this type of investment strategy is a never-ending cycle of rabies transmission in dogs, exposures then occurring in people, and inevitably the continuation of human rabies deaths. Ideally, a more equal balance of vaccine investment in both people and dogs should occur. However, it is difficult to justify reducing life-saving human vaccination programs in exchange for the long-term control of rabies in the dog population. Therefore, we have two options we must consider. Either we as a rabies community or a government must procure new funding sources that can be allocated to expand dog vaccination programs, or we must find a way to safely reduce the amount of money we are spending on unnecessary human vaccines that are administered and transfer those cost savings to our dog vaccination programs. Option 2 can be achieved through the development and implementation of an integrated bite case management program. At its core, IBCM is quite simple. Our goal is to identify all animal bites that are occurring within the community. Then evaluate the biting animal for any signs of rabies. Depending on that health assessment, we need to quarantine healthy animals for 10 days or test sick acting animals for rabies. And then lastly, we need to ensure that bite victims that meet certain risk criteria have access to life-saving rabies vaccines. Achieving a high-functioning IBCM program requires participation from both the human health and veterinary sectors. This is a community-based program and a service that should be accessible to any community member at risk for rabies virus exposure. IBCM is a true showcase of the One Health approach in action. While the basics of IBCM are rather simple, operationalizing this program can be complex and often relies on rapid and frequent communication between the animal and human health sectors. In some countries, this rapid communication has been achieved through electronic means, such as electronic medical records or smartphone applications. However, in most settings, including here in the United States, immediate communication is often conducted through good old-fashioned phone calls and text messaging. IBCM requires both human and animal health professionals to work together. Human health professionals are responsible for taking care of the bite victim, while animal health professionals should evaluate the biting animal. Both must occur in parallel. Case investigation results must be shared, and reporting of information should be bi-directional, so that the treating healthcare professional can perform a WHO recommended risk assessment and make further treatment decisions for the bite victim. While the focus of IBCM is on the reporting of a bite event, an advanced IBCM program should be capable of detecting strange-acting rabies suspect animals before they bite. Through strong community participation and a well-trained animal control workforce, this early detection of rabid animals can be achieved. IBCM is a critical health service for communities at risk for rabies. But in order to operate this program, communities and governments must invest in the training of veterinary professionals who are not only knowledgeable about rabies, but are also trained and equipped to be able to restrain aggressive animals, assess their health, and when necessary, euthanize rabies suspect animals. Investigators should be capable of identifying all persons potentially exposed through community investigations. They should be well trained and equipped to capture and confine potentially rabid animals, and ensure that an appropriate quarantine facility and time frame is implemented. They must be capable of performing euthanasia of suspect rabid animals, and then coordinate, collect, and transport samples to a laboratory. They also need to be able to prepare standardized animal rabies report forms for each investigation conducted. Additionally, it is the investigator's role to perform community outreach. This includes disseminating awareness materials to healthcare professionals and community members in the communities they serve. IBCM investigators are the literal front line of rabies control and not only perform life-saving duties, but also put their own health at risk when responding to potentially rabid animals. The safety of IBCM investigators is of the utmost importance and must be a consideration when developing an IBCM workforce. And we must realize that IBCM investigators will become quite bored without frequent reporting of bite events. So the training of qualified IBCM supervisors is also a critical component of a successful program. Typically, an IBCM supervisor will provide coordination between the different health and veterinary professionals. This includes contacting healthcare facilities to make sure that they share reports of biting animals, and then communicating with animal health workers to ensure that rabies suspect animals from the community are also reported. They are in charge of follow-up on reports by investigating rabies suspect animals in communities, coordinating the activities of IBCM investigators, and to ensure that humane euthanasia procedures are followed. Supervisors should also ensure that laboratory testing is linked to these surveillance systems. So they should ensure that labs receive samples and test in an appropriate timeline, and that these results are communicated back to the healthcare provider and the communities. They should also maintain a database of bite reports for surveillance purposes. And lastly, a supervisor should also have a great relationship with the community in which they're serving. This means implementing community awareness programs for rabies prevention and the IBCM program itself, as well as disseminating awareness materials to healthcare professionals and the communities. Like any surveillance program, IBCM should be based upon a strong case definition. The case definition shown here is based on the WHO and World Organization for Animal Health criteria for a suspected, probable, confirmed, and non-rabies case. Suspected rabies cases are those animals that show any sign of rabies virus infection. One way to remember these signs is to use the acronym ALPHA. ALPHA stands for abnormal aggression, lethargy, paralysis, hypersalivation, or abnormal vocalizations. Any of these signs, even just one, should place a biting animal into the suspect category, and any exposed persons should consider initiating the rabies vaccination series. Typically, through an IBCM investigation, a proper clinical evaluation of the animal is conducted, including an observation or quarantine period, or testing when indicated. and a final case status is then attributed to the animal at the conclusion of an investigation. These case definitions not only should inform the level of concern for which a bite victim should have for their exposure, but are also a critical component of a rabies surveillance system and can be used for early outbreak detection and monitoring program effectiveness. Your case definitions should be consistent with the international recommendations and should be directly linked to your PEP recommendations. While a proper WHO recommended risk assessment should be attempted even without an IBCM program, the inclusion of a proper veterinary or rabies expert assessment of the situation can increase the accuracy of post-exposure vaccination recommendations. The WHO recommends that the following factors be collected by healthcare professionals when determining if post-exposure vaccination is recommended. Time since exposure, the exposure risk, animal health status, including any test results, the number of other animals or people attacked without provocation, the availability for further assessment and quarantine of the offending animal, the animal's vaccination status, and the risk that the animal was exposed to rabies within the last 12 months. As recommended by WHO, when a biting animal meets the suspect, probable, or confirmed case definition, PEP should be initiated immediately. If the animal is under quarantine or pending laboratory testing, PEP should be continued. If lab results or the observation period show that the dog does not have rabies, then PEP can be discontinued. So long as the victim has received at least 2 doses of vaccine, they can be considered previously vaccinated in the event of a future rabies exposure. But we should also not forget that in certain settings, human rabies vaccines may be in limited supply or may be costly to the bite victim. When there is a reliable IBCM program in place, delaying PEP for low-risk exposures, particularly those that did not show any of the clinical signs of rabies, can result in a more sustainable human vaccine supply. Vaccination can be safely delayed when the animal is assessed as low risk by a trained professional, when the animal is alive, up to date with its vaccination, and has not been exposed to rabies in the last 12 months, or when the animal is up to date with vaccination and the attack was clearly provoked. Understanding how to assess a suspected rabies exposure is an important skill for any healthcare professional who's responsible for administering post-exposure vaccinations. In the additional resources that complement this module, providers will find 2 decision trees available for download and use to make their decisions. Right now, many people listening to this may be asking, how can my country afford to run an IBCM program? This looks expensive. You do need to invest in qualified veterinary professionals. You need to ensure stable human rabies vaccine supplies, and you need to establish a coordination mechanism between the veterinary and human health sectors. This absolutely is a lot of work. Well, if you are asking yourself this question, you're not wrong. Every intervention has a cost. The true measure of if a program is worth implementing is if the benefit of the intervention outweighs these costs. Many economists have evaluated IBCM programs, and in every publication, these programs have been proven to be highly cost-effective. For example, in Haiti, the IBCM program costs approximately 5 cents per community member per year and has resulted in a 50% decline in human rabies deaths. A very cost-effective intervention and definitely worthwhile of healthcare investment. In fact, IBCM is one of the rare interventions where not implementing this program actually costs more, particularly when considering the increased human rabies deaths that would occur. IBCM programs can have numerous benefits, which we will briefly discuss here. First, IBCM is a form of targeted public health surveillance. IBCM is typically a passive surveillance system. It is called passive because as a rabies case investigator, you are waiting for suspect rabid animals and bite victims to reach out to you. Once you are aware of these events, you go out and investigate. As a surveillance system, one of the first noticeable outcomes should be an increase in the detection of rabies case investigations, rabid animals, and bite victims. As the program's benefits are realized, community members often rally around these programs and begin to report exposures in suspected rabid animals at a much higher rate. And in more advanced IBCM programs, where suspected rabid animals are removed from the population early, we can actually halt transmission chains and reduce the burden of rabies in the community. Another benefit of IBCM programs that we have found is that when the results of an investigation are communicated to a bite victim, these bite victims are much more likely to comply with their vaccination recommendations. This highlights an important fact that informed patients are much more compliant than uninformed patients. And when patients and providers are both informed about the risks of rabies, it is much safer to prioritize vaccines for people with true exposures, leading to cost savings for governments and patients while also reducing the risk of supply shortages. And lastly, IBCM is the true example of One Health in action. It relies on the expertise and coordination of both human and veterinary health officials. Over the next few slides, I'll provide a demonstration of an IBCM program that was established in Goa, India. While IBCM programs can and have been operated with paper-based systems, there are key aspects of an IBCM program that make electronic data capture highly beneficial. IBCM programs collect multi-sector data, meaning that data is either gathered or transmitted from both the veterinary and public health systems. The data collected must be captured correctly and in a standardized fashion, as the information is used to make healthcare recommendations. And lastly, IBCM investigations often occur over several days or weeks, as we'll demonstrate in this example. All of these factors make reliance on paper forms troublesome. For this exemplar program in Goa, the organization Mission Rabies worked with my program at the US CDC and local health officials to develop a smartphone-based application dedicated to operationalizing their IBCM program. Field investigators have a phone or tablet on which they record the findings from their investigations on a standardized IBCM form. The results are transmitted to a secured server where program managers can view case records. This enables rabies programs to be much more rapid in their ability to evaluate PEP recommendations, improve rabies case surveillance, and earlier detection of outbreaks. IBCM investigations always start with the notification of an event. This often occurs through agreements with bite clinics and community leaders who call the IBCM program when an eligible event has occurred. For the program in Goa, Mission Rabies created a telephone hotline to report exposures and suspected rabid animals, while also making personal connections with the bite clinics, where they explained the IBCM concept and established formal information sharing mechanisms. A comprehensive IBCM program, such as the one in Goa, engages a variety of partners, including the public, private veterinarians, government veterinary officers, animal welfare organizations, hospitals and clinics, and local authorities. Upon notification of an event, the IBCM investigator must conduct an assessment of the situation. Trained investigators have a set protocol and forms for investigating both the suspected rabid animal as well as any bite victims, human or animal. The mobile application used in Goa provides the IBCM investigator with a structured investigation and provides in-app guidance such as recommending when an animal should undergo quarantine and when euthanasia should be considered. As I mentioned earlier, many IBCM investigations will span multiple days, particularly if the animal needs to go into quarantine. It is critical that appropriate recommendations are made to dog owners and that the IBCM investigator follows up on the health status of the dog at the end of the quarantine period. When indicated, the investigators are trained to euthanize sick acting animals, collect samples, and transport them safely to the laboratory. Testing of rabies suspect animals that have clinical signs consistent with rabies should be performed in a qualified laboratory that utilizes WHO or WOA recommended tests. Just like an appropriate risk assessment is critical for guiding human treatment decisions, inaccurate testing could put human lives at risk. The laboratory in Goa has worked with several World Organization for Animal Health rabies reference laboratories to receive training and is now capable of conducting several gold standard diagnostic procedures. The last and most important step of the IBCM process is reporting of results to all relevant partners to ensure that PEP recommendations and other interventions are well informed. While IBCM at its heart is a surveillance system, the primary benefits of this program are its ability to improve compliance of healthcare workers and patients to the appropriate vaccine recommendations. Maintaining trust in the investigators and timely reporting of investigation findings are perhaps two of the most important aspects of an IBCM program. Thank you for listening to this module on integrated bite case management. In this module, you learn that dog bites are extremely common, but the majority of these bites are not due to rabies, so it is crucial to use expensive PEP in a targeted way. IBCM is an advanced passive surveillance method that connects veterinary and human health professionals with their communities. It is truly One Health in action. IBCM offers a cost-effective solution to ensure PEP accessibility and availability. And the goal of IBCM is to identify all bite victims, to assess the health status of the biting animal, ensure the best PEP decision for exposed individuals are made, and to remove suspect animals from the community. Intersectoral communication, professional risk assessment, and standardized case definitions are key foundational components of an IBCM program. And lastly, IBCM increases the detection of rabid animals and exposed individuals and has directly led to decreases in human rabies deaths.